I was almost part of the Black maternal health crisis. Unconscious bias and a lack of maternity care can place women of color at risk of tragic birth outcomes. This is Donette's story, and she says, I was 49 when I became a mom for the second time, so I had plenty of time to prepare for my daughter's birth. Still, I came dangerously close to becoming one of the tragic Black maternal health statistics I worked hard throughout my career to prevent. Though I was on the other side of the surgical knife this time, I'd been a maternal fetal specialist for over 20 years. I arranged for my extended family to be with my toddler son so my partner could be by my side during the birth. This is her, and she says, but all my professional knowledge and experience weren't enough to outrun the risk. If you do not know this today, please know that being a non-Hispanic Black woman, you are at a greater risk. We are at a greater risk of maternal mortality here in the United States than a non-Hispanic white or Latino woman. So the facts are, due to disparities and a lack of education in women of color, the mortality rate is outrageously high. And to me, one death is too many. One death is too many. So if you know anyone that is pregnant, if you are pregnant, if you are looking to become pregnant and plan a family, I highly encourage you to know your rights, know what you can and you cannot do, and to really choose your doctors, choose your care team wisely, because it's so important. I am a Black woman, I am a Black mother, and I am someone that was a statistic. I pushed out 6 babies, and I remember each one of my births, they were high risk. I had to see high risk doctors, and knowing what I know now, there was a lot of things that went on that was not right. I remember when I was pregnant with my daughter, I went to the hospital believing and knowing that I was in labor, and only to get to the hospital for them to send me home in labor. So what I did was I went to another hospital, and by the time I got to the second hospital, I was already 6 centimeters dilated in active labor. But had I not went and got a second opinion, I most likely would have had my daughter at home or in the car or wherever I was. This is why education is so important, and knowing about maternal mortality, especially if you are a woman of color and you are looking to start a family, looking to plan a family, looking to have more children. Even if you have children, if you have daughters, this is so important to even educate them. And what's most important as well is learning and knowing your own body. Learning and knowing your own body. You cannot get enough of knowing exactly and knowing how to hear and listen to your body as a woman. If you have experienced anything like this or anything close to this, I want to know. Let me know, what are your thoughts? What are your experiences with your doctors? What was your experience during your birth, your delivery? Let me know.